talk about vitamin D. Vitamin D is a very important nutrient and vitamin in the human body. It is fat soluble. It is mainly produced by the skin. It is absorbed from the gut. It has its work with the liver and the kidney, which we will shortly take one by one. As we are near more in the equator area, you can say, and the sun is shining, we people absorb this vitamin D. Now, how this is done is that the sunlight is there and the ultraviolet rays, they on the skin produce vitamin D. If there is a high melanin content, or people use sunblocks and sunscreens, their vitamin D is gradually lowered. Also, if you are living in cold climates, winter season, and you move away from the equator, the vitamin D in the body becomes low. Exceptions to this are two important countries, India and Brazil, near the equator, but still the people suffer from low vitamin D. The dietary part. The vitamin D and calcium are absorbed from the gut, the intestine. Then they are circulated in the blood in an inactive form called calcidrol. And then it goes to the liver. From there into the kidney, it is reabsorbed into the active form, which is calcitrol 125 hydroxy vitamin D3. This is a very important cycle to produce an active substance in the body. Now, how is vitamin D helpful in the human body? Let us look at certain factors. First thing is that what are the dietary products which are very important? Fish and fish liver oil, which contains essential fatty acids, are important to the body, like cod liver oil, for instance. Then fish like salmon, mackerel, tuna, sardines. They have a high vitamin D content. Coming to milk and milk products, some of them are fortified with vitamin D, like Nesvita, for example, which is marketed in Pakistan. Then cereals, which we use for breakfast, also have, if they are fortified, they are good for people who have low vitamin D. Then we have got egg yolks and beef liver. These are also important patients from malabsorption, like chronic diarrhea, sprue, celiac disease. Then we have got tumors of the pancreas, tumors of the colon, definitely cause a fall in the vitamin D level in the blood. After this, little thoughts on the factors associated with vitamin D. We go up to the liver. In the long run, a failing liver, a failing kidney, with nephrotic syndrome, end-stage renal disease are all potential factors. When the vitamin D falls low in the body, people suffer, or they are associated with depression, schizophrenia. Then also they have dementia, Alzheimer's disease. There can be hypertension associated, or adult onset diabetes can be associated. Then respiratory problems, tuberculosis on one hand, allergic forms like bronchial asthma on the other hand, and most now what we see is the global COVID-19 pandemic, because it plays a pivotal role in the therapy of COVID-19 infection. How does it happen? Vitamin D builds up the immune system in the COVID-19 patients. It is very feasible in the mitigation of vitamin D therapy to reduce the mortality. The outcome and response in treatment is better. It is used with calcium, B12, magnesium, which helps these patients. And then studies are there which compare patients who have been treated on vitamin D and those who have been without vitamin D, and there is a significant improvement in the patient's symptoms who have been given vitamin D by the physicians. Then bone metabolism. It is very important. Vitamin D with calcium together deposits itself in the matrix of the bone to make it strong. Your bones are strong, your teeth are strong, your musculature is good, and so is your nerve conduction, which are all associated with one another. The low vitamin D and bones which are diseased and they become soft, you see in children which are rickets, osteomalacia and osteoporosis in the adults. We'll take up a little about and speak about osteomalacia and porosis, but in general, when bones are affected, overall people present with arthralgia, myalgia, proximal muscle weakness. There is unsteadiness in their gait. People have short stature, their height is decreased, they have a stooping position. They can be associated with osteoarthritis, rheumatoid arthritis. Important in the cheese, the cheddar cheese is the highest containing vitamin D and Swiss cheese as compared to the others. With moans and groans and these complications, if they are picked up, how are they managed? Simply, if they are conscious, you increase their fluid levels. If not, then parenteral normal saline with diuretics are flushed into the system, and even sometimes steroids is used. Overall, the toxicity will not go out from the body. It takes its own time, but with the passage of time, it comes down, and all vitamin D foodstuffs and tablets, injections, all should be immediately stopped, and the patient should be well monitored till they come to the normal, reasonable value in the body. So this is the problems associated with high vitamin D. Now, it was also seen that people who are obese, they have low vitamin D. Now, what is obesity and overweight? You eat, and if your intake of food is high or very high, and your energy production is there, but what you take in exceeds your output, which leads slowly to accumulation of fat in the diet, in the body, and you start becoming obese or overweight. Fats burn in the furnace of carbohydrates, so your diet, you should be cutting down on fats, carbohydrates, and salt if you have to control your weight. Say you go to the supermarket, you buy groceries, sugars, take 4, 5, 6 bags. They are overweight. How uncomfortable you feel when you are carrying these. Similarly, the heaviness with overweight in your body is very uncomfortable for you physically and also mentally, because it leads to mental problems, depression, and you have an obsession more for eating more and more. So these things should be picked up, and it should be avoided. Then, as you know, that slowly the fat, cholesterol is all deposited in the bloodstream. The same old story of strokes, cardiac problems, high blood pressure starts in obese people more, and they are more vivid and more complicated. Then the people, when they realize or they are told by the doctors that you have to lose weight, they said, okay, we go on crash diets or we use certain supplements which are advertised. Remember, they are not good. Your plan, it should be a long-term plan to reduce your weight. You should have a balanced diet together with more physical activity which is suitable for your age. By physical activity means jogging, people who can do it, or walking, which most of us can do, or also people, like, you have to use the stairs if you can, avoid the lifts, avoid unnecessary car drives. These are also important when you have to lose weight. Then your lifestyle is changed and you have a well-balanced diet, and you go on building this up, which is important, as you see that with the passage of time you come to a stage where your weight is good. But of course, nobody can reach an ideal target, but it is good or optimal, we can say. Now you can take the help of diet charts, usually which are in relation with heights, which are mentioned in centimeters, feet, usually 4.11 to 5. You should have an optimal weight, say around 45, 50 plus kg. If you go further from 5 to 5.5, you enter as a normal adult about 60 kg, and onwards, even if you go above 6, you can go over 65, but not more than 70. Then you cross that line and you become obese and overweight. And anything under 40, 45 is also underweight, which is also not good. Now, what foods will you choose to bring your weight down? Usually, as weight reduction starts, the target is to lose slowly, say half a kg per week or 10 days, that it should be. And then it should be maintained. People who use supplements to reduce, they use it, they get tired, they stop it, and there is a resurge or reaccumulation. And with the reaccumulation, the weight again increases and you come back to square one, where you started. So that is not ideal. The diet part is very important. As we said, low fat, low carbohydrate, and low salt. If you take first oils, you should go for oils. They are also important to the body, but you use oils which contain monounsaturates or polyunsaturates and not saturates. The saturated fatty oils are found in ghee, butter, heavy margarine, but the polyunsaturated or monounsaturated are found in cod liver oil, then sunflower seed oil, then soya oil. These are good for you. So you can use these. Then avocado nuts, then pears. Certain places the oils are produced and they are good for you. Then we come to the as we said, we remove the ghee and the butter and use these oils. The next is the cheese. People, you fond of cheese, try to avoid Swiss cheese, cheddar cheese. Use simple homemade cheese, paneer, which is good. And even cream cheese is not good. Thirdly, you come to milk and milk products. Use low-fat, skimmed milk, which is ideal. If you stop the high dairy milk and heavy cream, this will be good for you. Then we come up to the intake of meat, fish, chicken. This is important. Lean meat is good. Mutton is good compared to beef. And fish, as we have mentioned, are all good, especially salmon, tuna, mackerel, cod, and poultry, chicken. But the method of cooking is very important. You either boil or steam or cook it lightly or broil it, rather than use heavy masala and fry the food. So this is very important. Then the end organs, as far as meat is concerned, the brain, the liver, the kidney, should be avoided as possible. Coming to cereals and pulses, use unsweetened fortified cereals, pulses, beans, peas, that is good for your health. Then green vegetables, salads are very good. Avoid sweetened cereals, which are usually served at breakfast time. You should avoid that. Then coming to fruits. All fresh fruits are very welcome. But even canned fruits, which are canned in their natural syrups or natural juices, you can say, are good. But those which have high sugary syrups, they are not good for you. So you should avoid them. And then, of course, you can use in your salads and mayonnaise and spreads very low fat, but don't use the heavy fat and heavy high in cream and all that. With this at the back of the mind, you can surely achieve your goal. Look after your body, treat it well, and it will make a revolution or change in you. You will build more confidence in you. Even people in the COVID pandemic, most of the people are at home, so their vitamin D falls because they are not exposed, not going out. Elderly people, children 1 to 4 years, and people also prisoners. They are, and people in old homes, you see. So there the mechanism which was maybe good has been disturbed in them. So this also is affected.
Madam Sharma, आपने बताया कि ये vitamin D की processing is through liver and kidneys. In case of damage to these organs, how do you think we can?
You have to give them supplement. Supplement. You have to definitely. You have to first check the levels in the blood, which we have mentioned, and then you go with the treatment. In chronic renal disease, end-stage renal failure, they are always given vitamin D supplements, which are soluble vitamin and not complex vitamin. So that is usually. In liver problems, it is the same, but they need vitamin D together with calcium. Then there is zinc and other B12 and iron and whatever supplements. But since our topic is calcium, vitamin D, so really they are given. And people usually, there are also studies which say, okay, well, what is best? Daily vitamin D intake from the medication, or weekly, or monthly, or quarterly? Oral, parenteral, what is best? Because with patients in hepatic disease, their digestive problems are also not good. And as I mentioned, malabsorption with all the other disease. In those cases, they are given more parenteral, because it is no use if the absorption is not there, the diarrhea is there, you don't achieve anything. So rather give them parenteral, one injection of vitamin D in say about 3 months time. That builds up and it is sufficient level.